That's a really common question. All the patients are always worried about this.
Thousands of people put off hair transplants every year, not because of cost, not because of results, but because of this one fear. Here's what a specialist actually says.
I am Dr. Steven Walker. I'm a surgeon. I am specialized in hair restoration surgery and aesthetic medicine. I have more than 7 years working in hair restoration surgery and aesthetic fields. And I have been working in a lot of countries like Colombia, Mexico, USA, and currently in Spain. I did my college in Caldas University in Colombia, and I did my specialization in Mexico, and I did a master's degree in Spain. A hair transplant procedure is a surgical procedure that involves moving hair follicles from the donor area to a recipient area, primarily to treat hair loss. It works by taking healthy hair, healthy follicles, typically from the back or sides of the head, where the hair is more resistant to androgenetic effects and to thinning, and transplanting to the areas where hair is thinning or bald. That's a really common question. All the patients are always worried about this, but no, it's not a painful surgery. I know it's a surgery, it's a procedure, right? So the patient will feel some discomfort. We use local anesthesia, so there will only be a little discomfort with the first injections. After that, when anesthesia kicks in, the patient will feel nothing and will be so comfortable. When we determine that is an androgenetic alopecia, we will perform an assessment of the baldness area, the donor area, as I have explained before. So we can determine if you are able or not, you are a good candidate or not to the surgery. If you are okay to the surgery, we will recommend medical treatment. Sometimes you can go directly to the surgery, but in the most of the cases, they need that treatment before to stabilize the alopecia and improve native hair. So in that moment, we will explain you what we will do, how we will perform the surgery, and how we'll recover, restore the baldness area. And then I will explain you some hairs post surgery and explain the surgery and all that stuff, and you will decide if you want to do the surgery. First of all, clinical history. We need to know everything about your medical condition, right? Not only about hair loss. Maybe the cause behind your baldness is maybe hormonal disease or other disease, right? So it's really important to know to clarify the diagnosis, the first step. It all depends on the degree of the alopecia. If it is an advance, it may require 2 or more surgeries to achieve full coverage. But our team will try always to do the best when possible in the first surgery, but it depends. So it will take at least 1 year between procedures, right? Because we need to evaluate the evolution of the first surgery. But if the patient has a small baldness area, with one trip, one surgery is enough. But in the case with a large baldness area, maybe the patient will need 2 or more surgeries. After procedure, yes, we have some restriction or recommendations. The most important recommendation for surgery to the patients are avoid rubbing or touching the grafted area for the first week. The most important. Therefore, they should not wear t-shirts, caps, or hats or something can rub or touch the grafted area. And they should always sleep on their backs and use a cervical pillow to avoid turning during the night, and do not perform intense physical activities such as sport or gym for the first 3 weeks. Swimming, don't swimming for the first 1 month, but I always say to my patients, the more important restriction and the recommendation is the first week. Please avoid rubbing or touching the grafted area. Past the first week is so easy. And not smoke. That's really important too. Not smoke the first 3 weeks after surgery is really important. The worst scenario is when patient trying to wear polo or t-shirt, they rough or touch the graft area and it take out the graft. But if it happens here in the clinic or nearby to the clinic, we can try to place again the follicles on incisions, okay? But if it happens maybe 2-3 days after surgery, in the patient's home or something like that, and there is no time to stay here in the clinic on time, that's so bad because the graft will die and we cannot introduce again the follicle into the incisions. So the patients won't have a regrowth of the hair in that specific part when the follicles get off.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.